So I often am asking, what's happening with sex in your life? Are you active? Is it comfortable? Do you have pain? And a lot of patients get very uncomfortable when you ask, but it's an important question. And once you explain to them why it hurts, because your estrogen is dropping and your secretions are less, it's drier, the tissue is tighter, it's not as elastic, your libido is lower because your hormones are so low. Cognitively, you're spent, right? And for us as women, everything has to be wonderful. Our relationship has to be good. We have to have had a good day. We have to have some energy to want to even think about having sex. And so give women permission to not have that energy at the end of the day. A lot of it has to be that your relationship is good as well. And then physically, with dryness, it has to be treated. Explaining to women that it sometimes is very common to have a lot of dryness and you need medication to treat, and that there are things we can do to help make sex more comfortable. Who wants to have sex when it's painful? That's just going to turn off your libido. So having those discussions. And then the next thing I often say to patients is, have you talked with your significant other about this? And some patients have, but some have not. It's like an unspoken word, and there becomes a disconnect between the relationship. And so sometimes the advice I'm giving is just have a conversation with your partners. Tell them you saw me today and I brought it up. Blame me. It opens the door that it is an important topic for you and that you do want to make it better. And it gives your significant other insight that you do want that connection.